So let's just for a moment go to one of the proposals in California under Senator Sheila Kuehl from the Los Angeles area. And she is not only saying that they will have government ahead of the insurance, all Californians will be able to subscribe to the health care and be covered. So all of them will be covered. That this plan should open up the opportunity, given the organization she's also suggesting, commissions, doctors, the head of commissions, to see if she can open the door to the provision of health care. And so far, she's having enough trouble just getting it over for the financing. And
well, that's right.
And the marvelous story is, you know, she was the head of the committee just recently judging Schwarzenegger's plan. She voted against it.
But the opposition to the Schwarzenegger plan was much, much broader than simply Senator Kuehl.
Yes, I know, but she's the head of the committee.
Plan. She was the chairperson of the committee. But it's critical to recognize that when we begin to change health care for patients with chronic disease, it's not just going to change the way doctors behave. It's going to also have to change the way patients behave. Because if you think of it, a chronic disease means an illness with its handicaps that goes out over an indefinite time period. Who lives with that? The patient, the family, but primarily the patient.
How well
and
some of us know.
Every day of that long time period, the patient is addressing the problems created by the illness. The healthcare system that we have does not educate the patients in the best ways to do that. And if they do get certain assistance, it doesn't support them in doing that. No. It does not allow physicians to engage in education of their patients because it does not reimburse for that.
Now, would you say that the private insurance companies have an impact on this?
No, they have a negative impact. They have not included appropriate patient education in the benefits that they provide.
Are they an obstacle to?
Well, it's hard to say. Yes, of course they're an obstacle because they don't do it. And the reason they don't do it is that they, number one, are in the business for profit, and therefore they are very much concerned about adding additional benefits that would increase the expenses of health care in their minds. And they're not familiar enough with the advantages of developing an appropriate care model where over time you would actually get better health outcomes and less cost.
So
it's known how to do that today.
Right. Now, does this mean that the change in the financing, getting government to have a greater role in it, really opens the door to handling the problem of chronic care?
I think it does. Now, that's an opinion because the government would control the insurance system and consequently be in a position to influence the way the resources are used, what types of services would be provided, what structures you'd have. And if the government did that well, it would be possible to move rather rapidly to improve health care for those with chronic disease and therefore get the better outcomes and the less cost. Of course, if the government didn't do it well, that could also lead to perpetuation of our problems. So there is a significant issue here, not just about who is going to influence or be able to have the authority to influence the practice of medicine, but how they do it. The insurance companies can't possibly deal with this because they're fragmented, in difficulty already financially. They're not able to cope with the rising costs of care, the introduction of new technologies. They have no authority over the practice of medicine. So they're in no position to influence it. a wise government program that brought professional
Is
organizations.
Medicare going in that direction at all?
Slowly, yes, and that's because the leadership in Medicare is cognizant of the fact that unless something is done about the care of the chronically ill, their cost future is going to be bleak. So they recognize that they've got to foster different, more effective and efficient
Now,
care.
in our conversations, I've said to you that I can understand people looking at the alternatives to insurance and saying, gee, I've learned something and I'm going to do something about it. I'm going to call up my congressman. What do they do about changing medical care?
Well, that's a difficult question and can't be covered in the short amount of time that we have here. And of course, I only have opinions about that. I don't know exactly. But what the average citizen can do is look most carefully at how the candidate's proposal addresses the question of cost control and of care of chronic disease. And they do differ with regard to that. So that although Senator Edwards has decided he's not going to continue running, he had a program that had private insurance persisting, but significant regulation of it. And for those who could not afford the premiums of the private insurance system, could enter directly into a government insurance program, health insurance program, that would cover them.
Which means that really, if this type of health plan were really implemented, that in time it should win. It's got the economics on the side.
You mean a universal
Right.
government-run health insurance
Right.
plan? There's no doubt about that. There have been so many good studies of both the healthcare side of it and the financial side of it that we know that a national, universal, governmental health insurance plan would be the most effective and most efficient way of organizing our health care. And interestingly, increasingly, professional organizations like the American College of Physicians are beginning to recognize that that type of an approach is much more likely to be cost efficient and effective in the way it cares for patients than any
let's go
of the
back
other
to this.
alternatives.
What does the average citizen do? Where do they make any impact on this?
Well, the other thing they could do is talk to their doctors and say, you know, we're now beginning to understand that insurance isn't just the issue. Good. Another side of it is how we get our care. And what are you and the professional organizations doing to ensure that care is improved in quality? But there's one other thing you said, what can a citizen do? A citizen can learn about these plans, whether they're Schwarzenegger plan or the Obama plan or the Clinton plan, and also learn about the Kuehl plan, the single payer or statewide universal health insurance proposal, and look at them side by side from a standpoint of what is public and transparent about how the plan works and what services they can get, and decide whether they want to influence it. Remember, the Assembly and the Senate in the California legislature voted to support the Kuehl plan.
That's right.
The Senate, in this recent instance, or at least the Senate committee, rejected the Schwarzenegger plan. Now, they also didn't resolve the finances of the Kuehl plan, so one has to be candid about this. But the point is that there is a realistic political debate and set of political options that a citizen could enter into as a participant in decisions about what kind of health care we'll have, supporting one or the other.